let me thank Mr. Srikumar Raghavan for inviting me as one of the panelists in 80th Rajagiri Roundtable Conference. Like you said, a lot of issues we have been facing for the last 2 years, and we all know that COVID-19 pandemic has had a major effect on many of us, our lives. And we face challenges that can be stressful, overwhelming, and can bring about strong emotions in adults and children as well. We know that public health actions began with isolation, quarantine, lockdown twice in Kerala, and social distancing and quarantine are still in action. Work from home for the officers, an online model of classes for children, which was not ever heard in our society, was initiated, and it has been continuing. And many of us don't have the privilege to sit at home and work, and we have to go to the workplace taking all the risk of contracting the illness. And now we have reached a phase of hybrid working mode. Looking back, we realize that all these changes in our lives hit our mental health hard. And who are suffering the most? I would like to say our children are suffering the most. They lost their playground, their sports events got cancelled, all educative supporting systems services got closed, and they are getting addicted to the gadgets. Internet gaming disorder or gaming addiction disorder is another risk our kids are facing, and recently World Health Organization has put this as one of the behavioral addiction illness. And our children are denied of letting out their energy levels in their growing period, and they tend to get into wrong relationship and other risks associated with it. And all these things are the major issue most of the families are facing. Our children get more irritable. Their emotions get dysregulated, and parents find really hard to tackle it. And it is very sad to say that worldwide the rate of mental health symptoms in adults also has been elevated. There are many reasons for it. Like someone else was talking, unemployment is another issue for stress, then losing jobs, then taking care of children as well as there's adults who are always at home, and work-related stress, reduction in salary, losing jobs. All these things adds to the crisis. A recent study which was conducted in Kerala, the finding is very interesting. It shows that domestic violence reported is nearly 70%. And 70% is not a small number. There are immense reasons for the stress. Major is spending more time each other. This results in monotonous pattern of lifestyles, and more time is available for discussion of unpleasant matters. Then definitely financial crisis. Then there is a history of rise in substance use, and there is no opportunities outside the house for recreation or get together. Even functions have got cancelled. Usually these kind of outings neutralizes the stress, but unfortunately these are also cancelled, and spending day after day with the same people can make even the devoted couple go a little crazy. They can become lethargic, and monotonous situations in house can result in numbness towards others' emotions. Now, let's see how these stress affect our lives. We can feel fearful. Anger management issues is one of the major byproduct, I can say, because of the stress. We can feel sad. We tend to worry. We feel frustrated. We can have change in food habits. We may become more hungry, or we may lose our appetite also. Our energy levels can become less, and we may lose interest in doing things. We may become lazy. We can have poor concentration. Then we have difficulty in decision making. Our sleep can get disturbed. That can be associated with nightmares. We can have headaches, which is stress induced. Then body pain. Then stomach problem. Then skin rashes. Then worsening of our already existing illnesses also can be there. And like I said, there can be risk of substance use. Then coming to the children's stress manifestation, there can be poor academic performances, and they can lose their interest in studies, poor attention, behavioral changes, getting irritable for no reasons, shouting at parents, gadget addictions, then maladjustment temperaments and personality patterns, and risk of other behavioral addiction too. Now, let me tell that to advise how to overcome this, it is very difficult to put across in the time allotted to me, but I'll give an overview how to overcome it. And if it's not, if it's not enough, or if anyone else has any other doubts, you can ask questions once the discussion is over. First, what we have to do is we have to recognize stress, from where it is coming, what pattern of stress we are having, and how does it affect us. Once we recognize stress, we have to do certain things to overcome it. Number one is avoid whatever possible stressors we can. For example, certain things, if we can avoid, then don't put your hands on it. Somebody was saying here, I think ma'am, the school teacher was saying, vice principal was saying, we should learn how to say no. When we take multiple responsibilities on our head, we may not be able to do everything in the given time or allotted time. So whatever possible additional responsibilities we are going to take up, we should learn how to say no to it. Similarly, we can avoid people who put stress on us. We can avoid tasks that gives us stress. But sometimes what happens is we may not be able to avoid everything. In such cases, we have to alter the situation. For example, when we are stressed out, we tend to put it in our heart, and that keeps mounting, it keeps bottling up, and if you don't vent out in correct time, ultimately it results in we breaking out. So instead of making ourselves in that kind of a situation where we burst out, we try to express our feelings each time when it is warranted. In that way, we can alter the situation. Second point is we should be willing to compromise. In order to avoid situations which is stressful in our family, many times we have to compromise. And we should be willing to compromise, but unfortunately, if we are too much egoistic, we may not be able to do that. But in order to have a healthy relationship at home, our heart to compromise or our willingness to compromise should be very high. Third thing is that we have to manage our time properly. Many a times we won't be able to finish our task in the appropriate time. We will juggle everything together. We will mix up everything together, and ultimately we don't do anything in the correct time. We may tend to push aside the most difficult task. So all these things should be calculated prior, and our time management should be perfect. All these things will help us to alter the situation in case if we can't avoid that particular stress. Third point is, if we are not able to avoid the stress, or if we are not able to alter the situation, then slowly we have to get adapted to the stressor. When we get adapted to the stressor, what we have to do is first reframe the problem. Reframing the problem, we have to see in a more positive perspective. Like initially our ma'am was saying, Khairunisa ma'am was saying, she was putting across the positive aspects of COVID-19. Similarly, even if we are in the stressful situation, we should find out, is there anything positive in that to take it? But as human beings, our brain is molded in such a way that we always tend to look at the negative aspects only. So if we look at, or if we focus at the negative aspects, we won't be able to adapt to the stressor. So what you have to do is view in a more positive perspective. Second thing is look at the big picture. For example, now the pandemic situation is going on. Now almost 2 years are over. We have entered to the third year. But still what we have to say in our heart is, this will get over one day. This won't be permanent. So when we look at the big picture, we get a positive point out of it. Other things which I regularly find in my practices, especially working women, they come and they complain their difficulty in handling household work related to their office, then managing family issues, children, everything. And probably the children will be very small, and there won't be any facilities of the grandparents to rear the grandchildren after. So in such cases also, how long it will last, we have to ask ourselves. Maybe for 3 years or 4 years, after that the child will grow. We can send them to the KG. Similarly, the pandemic won't continue for a long time. Now we have reached a hybrid phase. Now there is no more lockdown. There is no more strict isolation. We have some amount of freedom. So slowly we are entering to the normal, fully fledged functioning level and normal phase of our life. So when we look at the big picture, I'm just saying an example. So when we look at the big picture, we can slowly adapt to the stressor. Next point is, We may not be able to avoid the stressor, we may not be able to alter the situation, we may not be able to adapt to the situation. So what we have to do is accept the stress, accept the thing which you can't change. Most of the time what we do is, when we face situations which we cannot have, which we cannot control, or sometimes without our knowledge or without our wish, uncontrollable things happen in our life, which means we cannot control from our side. When such situation happens, when we are not in a position to control it, there is no point in having a tug of war with it. So when such things happen in life, don't try to control it, accept it the way it comes. So when we try to accept it, we have to change our perspective also, or we have to change our view about it. You can get adjusted to the standards which you have. Many of us are perfectionists. We may want to do everything in perfect way, then only we'll have a satisfaction. Learn to be okay, or learn to be okay when it is good enough. In that way, we can adjust our standards and accept it the way it is. The next important point I would like to say is, we always should control, we always should check our anger levels. Many of the times the relationship get impaired or relationship get affected when the anger level is high. From my clinical experience and also the literature I have been going through, the major issue which affects a healthy relationship is the anger outburst of any of the partners or both the partners. Because of this pandemic situation what we have at home, all the family members, including parents, children, grandparents, everyone will be at inside the house, and they don't have any other situation other than facing each other and receiving each other's burden and frustration. In such situation, we tend to become very angry. So what we have to assess is, what is the baseline happiness of our family? If the baseline happiness of the family is good enough, then the rest of the points which I'm going to say is going to work. But if the baseline happiness of our family is not good enough, then these points may not work, and you may have to take the help of a professional person who handles this. So first what we have to do is check our anger levels. If it is too much, then we can distract it. Simple tips I can tell you: we can drink a glass of water, we can take few deep breaths. Deep breathing helps to de-escalate the anger. Then distraction techniques might work. Then remember the good qualities of the other person, so that when we find something good in that person, we may not feel like shouting it back. But when anger gets escalated, what we have to do is we advise timeout, which means a temporary separation from each other. We can go to separate rooms, or one of us can go out of the house, and a timeout can be practiced if the anger is going out of control. Then another way is we can maintain a anger diary, which means take a book, makes columns, and write down the frequency of the anger outburst we are having. And the second column, what made us angry and how did we react? And was there any other better way to react, or was there any other better way to communicate that we are not happy with the other person's interaction or other person's behavior? And ultimately we find that we did not gain anything other than losing the whole day. The other person also did not gain anything other than losing his or her own whole day. And ultimately we made the other person sad. We also became sad by ourselves. So these things are not going to help us in any way. So this realization each time will help us to reduce the number of frequencies we get angry each other. Then other thing is that like I said, if the baseline happiness is okay, then certain tips which I'm going to say is definitely going to help all of us. That is, make time for fun and relaxation. We can have a good connectivity. When I say good connectivity, it is not the number of friends we have in Facebook, or it's number of contacts we have in our phone. Facebook friends or contact numbers which we have do not determine the quality of friendship or the quality of relationship we have with some other. Maintain good connectivity means maintain good relationship, deep relationship, healthy relationship, in a way that whenever we have an issue, we should be having the freedom to open it up and speak to that person. And whenever we are in a crisis, we should be able to approach that person. In that sort of comfort zone should be there between that particular person and yourself or myself. If I place myself in that situation. So in that way, maintain good connectivity, and doesn't mean that how many groups we are in, or doesn't mean that we have a good WhatsApp connection. This is not what I meant. Second thing is do exercises regularly, because exercises help us to vent out our bottled up negative energies. Many times we have a confusion, what is the best exercises we can do. Minimum exercises is 30 to 45 minutes of aerobic exercise, I would like to say. But please don't do it at a stretch in the first day itself. It should be in a graded way. Maybe if nobody has started doing exercises in any time recently, first start with 10 minutes, then slowly increase the timing, maybe then 20 minutes, 30 minutes, like that. And first start with slow pace, then make it faster, then towards the end make it again in a slow pace. This is how aerobic exercises have to be done. Otherwise, we may have to compromise our cardiac output, everything. So do exercises regularly, and exercises are the way, especially aerobic exercises help in releasing certain natural neurotransmitters or natural hormones in our body, which will help us to keep ourselves happy and confident. So if you are getting something free by nature, why don't we take it? Third thing is spend time for hobbies. We all have our own passions, we all have our own hobbies, and spend enough time for that, which will help us to be relaxed. We can listen to music, we can watch comedy, or we can make sure that we do something which we'll enjoy every day. Then like the ma'am was saying, we should maintain a good healthy diet. Healthy diet means take good amount of protein and less carbohydrate and less fat. This should be the pattern of healthy diet. Then if possible, avoid alcohol, cigarettes, or any other intoxicating substance. Then always try to have a good enough sleep. So when I say good enough sleep, doubt is how many hours will quantify to a good sleep. I would like to say some people will have 7 hours, some people need 7 hours, some people need 6 hours, some people need only 5 hours. The point is that when we get up in the morning, we should feel fresh. We should not have any hangover, and we should feel that we had a good and adequate relaxation after having a good sleep. That is the definition of good enough sleep. So when we have a good enough sleep, what happens in our brain is all the neurotransmitters or the functioning levels of the brain, it gets reset, I would like to say, and this helps us to recharge ourselves for the next day. And these are the few points which I have said, and I would like to conclude by saying that we should have a positive attitude to all our problems. See, we cannot have a life without a stress. So once this pandemic is over, something else will come. We know that we were affected with flood twice in Kerala, then now this pandemic. So once one is over, the other thing we can expect. So every day or every point in our lifetime, we can have stresses. But what we have to have is a positive attitude to everything. I'll wind up after saying an example. When the enemies were surrounded, a German soldier, how he responded and how Hitler, the ruler, responded will give us an insight how the attitude designs our life. When the German soldier said, "So we are surrounded by enemies on all our sides," Hitler responded, "Excellent, we can attack in any direction." This should be our attitude when we face problems in our life. Either we can say we are surrounded by enemies, we are surrounded by stressors, or we are in the depth of the stress, we cannot come out, we can view in a negative point, negative aspect, or like Hitler viewed it, we can say, excellent, we can attack in any directions. Always there is a fight between stress and our coping skills. We always, come across stressors, and using our coping skills, what we are doing is we are trying to fight it out. So if we have a positive perspective, if you have a positive attitude, definitely we'll be able to attack that particular stress in all the directions. And attitude designs our life. Thus I conclude my talk.